the nasal septum and lateral wall of nose. So in this we will be discussing the topic or the competency, features of nasal septum and lateral wall of nose, their blood supply and nerve supply. So in the picture you can see the nasal cavity is divided into two halves by nasal septum. Each half of nasal cavity has the following: a roof, a floor, a medial wall and lateral wall. And it has three regions starting from below upwards. The outside, that is called vestibule. Then there is respiratory region, and on the top there is olfactory region. First we'll start with nasal septum. It is made up of the following: septal cartilage anteriorly, omer and perpendicular plate of ethmoid posteriorly. And there are also small minor contributions from nasal, frontal, sphenoid, maxilla, palatine bones and palatine bones. It is often deflected. The septal cartilage is often deflected. Vessels of the nasal septum. The vessels of the nasal septum are anterior and posterior ethmoidal, the branches of ophthalmic artery, sphenopalatine branch and greater palatine branches of maxillary artery, septal branch of facial artery. The veins draining the nasal cavity are sphenopalatine, facial and ophthalmic veins. Nerves. Nerves include anterior ethmoidal branch of nasociliary, nasal branch of infraorbital, anterior superior alveolar branch of maxillary, medial posterior superior nasal branch of pterygopalatine ganglia. Then we start with the lateral wall of nose or nasal cavity. So first we will see the bony structure. The bones forming it are maxilla antero-inferiorly, perpendicular plate of palatine and ethmoid labyrinth superiorly. The other bones forming the lateral wall are nasal, frontal process of maxilla and lacrimal. Lateral wall. It has three conchae. They are shelf-like projections from the lateral wall of nose. Superior concha is the shortest and shallowest. The middle concha is large. Inferior concha is an independent bone. In the lateral wall of nasal cavity, below and lateral to the corresponding concha, there are meatus. So there are three meatus: superior meatus, middle meatus and inferior meatus. Then we have openings into meatus. Into sphenoethmoidal recess, you can see in the picture, into sphenoethmoidal recess, sphenoidal air sinus opens. The superior meatus has the opening of posterior ethmoidal sinus. Middle meatus is continuous with the atrium, that is front of middle meatus, and has the following features: one elevation, that is called as bulla ethmoidalis, and below the bulla ethmoidalis there is one semicircular hiatus semilunaris and also ethmoidal infundibulum. Openings into meatus. Anterior middle ethmoidal, frontal and maxillary sinuses open into middle meatus. Nasolacrimal duct opens into inferior meatus. So these you can see in the picture. Nerves of lateral wall. The nerves of lateral wall include anterior ethmoidal branch of nasociliary, anterior superior alveolar branch of maxillary, lateral posterior superior nasal branch of pterygopalatine ganglion. Thank you.